we are 9 kg overweight, it doubles our risk to heart diseases and triples our risk to cancers. If you are suffering from weight related issues, check out the link to my videos which will pop up at the end of this video and understand the complications of obesity and easy steps for weight loss. Weight loss is not always easy and numerous factors can bring it to a standstill. It is a process and it might not happen as quickly as you might like. There can be multiple reasons which can slow the progress of weight loss and which are worth considering. So let's check them out. If you are unable to lose weight despite of eating properly and exercising regularly, stress might be the reason. Stress does not only affect your waistline but it also makes you susceptible to infections, making you fall sick very often. When in stress, our body releases stress hormone cortisol, which increases cravings, blood sugar levels, and deposition of fat. Studies have shown that stress leads to slower metabolism and greater levels of abdominal fat, which can be particularly tough to shed. This abdominal fat results in greater health risks than fat stored in other areas of the body. High stress levels lead to number of behavioral changes which might ultimately lead to weight gain. Nobody can tell you how to manage stress. They can all give you advices. You yourself have to understand which way works best for you. You can try doing yoga, meditation, pranayam, breathing exercises. For some people, working out in a gym or playing a sport is a better method to relieve stress. Think and explore the activities which might suit you the best. Love yourself, respect yourself, and try to learn a way to let it go. Some people are naturally less sleepers and some people sleep less intentionally. Food habits, lack of exercises, irregular sleeping patterns, wearing work styles may all interfere with sleep and lead to sleep problems. Irregular or improper sleep is a known culprit for high blood pressure, diabetes, heart diseases, and obesity. Poor sleep causes weight gain and obesity, increased appetite and cravings for high calories, carbs or fat, slow metabolism, insulin resistance, constant tiredness. You should always aim for at least 7 to 8 hours of sleep. People often choose to change their diets drastically without any guidance or without any consultation with their doctors. This might lead to various health problems, like skipping a meal might lead to acidity, heartburn, nutritional deficiencies, headaches, and other gastric complaints. A keto diet may have a negative impact on liver or kidney. It can also put you on a risk to a premature death. If you skip meals often, you might experience low blood sugar and naturally you would long for a sugary snack. But the body processes sugar fast, so the energy surge quickly wears off and you are left craving another sugary snack. In case of a keto diet, there is a risk of nutritional deficiencies because you won't be having a wide variety of fruits, vegetables, and grains. A keto or a ketogenic diet is a very low carb diet with moderate amounts of proteins. This diet allows the body to switch its fuel supply to run mostly on fat, burning it 24/7. Fat is metabolized in liver and kidney helps in metabolization of proteins. So, before starting this diet, discuss with your doctor if you have an existing problem. A keto diet might lead to constipation as it is low in fibrous foods like grains and legumes. Also, there is a study published in The Lancet suggesting that staying on these diets for many years or decades might increase your risk of early death. Always discuss with your doctor before making a dramatic sudden change in your diet. Try to follow a diet which is practically feasible. Following a restrictive diet, no matter what the plan, is difficult to sustain. Once you get back to a normal diet, the weight will likely return. Food cravings are insane. One way you are trying to lose weight, and on the other side, you fill up your plate with rich, sugary, fatty foods. It is quite irritating because you know what you are eating is absolutely wrong and it will not help with your weight loss. In my clinical experience, most of the people with cravings for sugary, rich, fatty foods are nutritionally deficient. Once you improve their diet or add supplementations, these cravings improve drastically. These cravings are more commonly seen among vegetarians as the vegetarian diet lacks certain nutrients like vitamin B12 and vitamin D. Also, this vitamin D deficiency has been linked to obesity. Another very common reasons for cravings are stress, sleep disturbances, or irregular eating patterns like skipping a meal. Try to replace your cravings with cashews, walnuts, almonds, fruits, popcorns, dark chocolate, prunes, etc. If you are having these cravings, discuss with your doctor and get your nutritional level tested. Try to have a proper balanced nutritious diet and hydrate yourself. Usually people choose an unhealthy method of weight loss, that is by modifying their diets only. Try to follow a healthy method, that is the combination of exercise and changed diet. Exercise is an essential key for weight loss. Apart from fighting obesity, exercise helps in lowering the risk of certain cancers, heart diseases, diabetes, osteoporosis, etc. It is also good for mental health and helps us in managing our stress levels. Some people feel good in gym, some while swimming, some while doing yoga, and some feel good while jogging and cycling. You have to understand which exercise suits you and make you feel good. Go slow and learn the correct technique. Check with your trainer, learn the right way. Improper techniques and going too fast with the speed can lead to serious injuries. Know how to differentiate your pain. Pains are common while exercising because of the soreness of muscles. This is a good pain. Any kind of pain which is acute, sharp, dull, that progressively gets worse and is more intense as you work out is a bad pain. Take a break and meet the doctor. Do not focus on one kind of exercise. It leads to monotony. Have variation. Try to combine cardio, strengthening exercises, and flexibility workouts. Usually, people try to have all their focus on the body parts they want to improve, for example, chest, arms, or only abs. Our body functional systems are interrelated. One part depends on another. So, concentrate on strengthening of the whole body, not just one part. If you are not used to strenuous physical activity or if you are 45 years and above, get a physical examination done before starting any exercise regime. Try to create a plan with attainable goals so that you are motivated to continue. Try to aim for 45 minutes of daily workout. Obesity is not just a cosmetic concern, it is much more than that. It increases the risk of heart diseases, high blood pressure, high triglycerides, type 2 diabetes, stroke, certain cancers, breathing disorders such as sleep apnea, osteoarthritis, depression, and many more. The good news is, even the modest weight loss can prevent or improve these health issues. The management of obesity includes lifestyle changes, medications, or surgery. Medicines and surgery should be your last resort. Your aim should be to attain and to maintain a healthy weight. So, calculate your BMI, measure your waist circumference, know your problem, solve your problem. All the best for a healthy weight loss.